The problem of the coronavirus has become a major challenge for different arms of our society, and different groups are taking on this challenge. They are trying to deal with it at different levels. At the community level, awareness has been low, and today we have the Pharmaceutical Society of Nigeria, Abuja chapter, trying to increase awareness of the coronavirus, and at the same time trying to also give some talk about drug abuse and the rational use of drugs. With me this morning is the chairman of the Abuja chapter of the Pharmaceutical Society of Nigeria. He is here to talk about why this was initiated. You're welcome, sir.
Thank you very much.
Yes.
My name is Pharmacist Jalili Adewale Kilani. I'm the chairman of the Pharmaceutical Society of Nigeria, Abuja. Just like it's been said, the coronavirus disease pandemic, it's a disease that has ravaged the entire globe, Nigeria inclusive. And from the first index case early this year up to now, the number of affected and infected people has been rising. However, people who have not been affected, some of them are still skeptical. They are still doubting, is this thing real? And so we as pharmacists, as medical people, as medicine experts, because we cannot produce medicine without knowing about diseases. We know that this disease is real, it exists. Even though it's not a death sentence, but whoever is affected by the disease, the severity, and any family that has lost someone to the disease will know that it is real. In the hospital now, we have more than 20 patients that we are treating in our hospital, national hospital, so which is an isolation and treatment center. So we are saying that this thing is real. So we have taken the campaign regarding the awareness of this COVID-19. We have brought it to this community, Pape community here in Abuja. We are medical people and we are interested in the well-being, the health and well-being of the society. Because whatever affects one community affects all the others. So we want people to be aware of this disease and want them to take precautions to also cooperate with the government.
Well, drug no dey. You get the same way we say prevention better pass cure. So because the medicine over there, and no be say they don't even get the vaccine, where dem go give, where go prevent am. The message wey we carry come, as someone the way they work for hospital be say, make you not allow yourself get the virus. And you start with, I go even talk and say, we divide am into 3. 1, now in terms of make you dey clean. 2, now make you eat well. And 3, make you carry yourself comot from people wey get am. And in terms of make you dey clean, na be this face mask wey see say I wear for my face. You know the virus na something wey dem no dey carry eye see. E no dey show for face, e no dey show for body. Your pikin, e no dey show difference between father and mother and pikin. So person wey dey close to you fit get am, you no go know. But if you cover your face, in terms of hygiene, wear face mask, come wash your hand. Wash your hand well with soap. No be say you go carry water for plate, put soap, wash. No. You go get pump. Even if you no get tap, you get bucket wey they don't do. Where dem put tap head, water go dey flow. And as you dey wash the hand, you go sing happy birthday song. Wey be say you go sing am 2 times, then go do that 20 seconds. When dem dey talk say make you wash the hand, you wash am well.
Drug.
And another
A drug, we call drug abuse substance abuse too, because whether na cigarette o na drug, whether na alcohol na drug, whether na the one wey you buy for pharmacy o, tramadol, cough syrup na drug, whether na solution you drink, gutter water, spirogyra, lizard, all of them na drug. Because drug is something wey when you take am go change the way your mood be. Maybe before you were sad, And when you take that thing, start to dey smile, you dey feel happy. That is a drug.
Wà ní gbogbo ní FCT ní Abuja. Àwa rí pé ìlú Pápé ìlú tó jẹ́ pé àwọn èèyàn gidi wà ní. Àwa ní pé ìgbèrú ìtọ́gbé ìgbọ́n àpọ̀ supplement na-edozi ahụ. Enwere vitamin C ọ na-enye aka ka ha gbasie ike. Enwekwara nke a na-akpọ zinc tablets ọ na-enyekwa aka ka arụ gbasie ike.
Sunana Abubakar Daraka, ni ne editor-in-chief na wannan kungiya na masu hada magunguna a Abuja. A takaicen takaitawa sakon da muka ba wannan al'umma. We actually came to this community in Pape to do a health outreach to educate and sensitize them about the dangers of COVID-19, how to prevent themselves, and also demystify the myth that is going around that this is fake and this is not true. So we're able to prove it to them that we are experts in this field of pharmacy and we are health professionals and we want to affirm them and sons of soil, people with them. We spoke in Hausa, Yoruba, Igbo, Pidgin, communicate to them as communities, bringing down the message to their level and interacted with them. And from the responses we are hearing, it's like for the first time they are beginning to understand that this is actually a public health concern, that they need to cooperate with government to stop the spread, because coronavirus is spread through human-to-human contact. That's what we came here for.
So we are with one of the elders of the Mpape community, and he wants to talk to us about how he feels. What's your name, sir?
My name is Dauda Ibrahim Wasi.
Okay. So how do you feel about the sensitization that you received today?
Mun yi farin ciki da zuwan mutanen nan na pharmacy COVID-19 response. I really appreciate the way these people visited us today in Papi, which has been never happened in my life or since during the starting of this coronavirus. So they are visiting us here is very important, and really we are going to tell our people more than before about this coronavirus, because the way they explain the matter, the disease, we understand more than before that we've been hearing it through radio and television. But now today we have seen the real about what they tell us, and by God's grace, their visiting will make other people happy, even though those people that doesn't come here will explain more today.
My name is Hadi Abdraman.
Okay. So, how do you feel about this sensitization that took place today from the pharmacists?
The thing una come, so una try, una thank you for una all of una.
Okay.
So the thing I beg. Me, is Hadi Abdraman, that don't kill my boy, 36 years. I no get husband, I no get anybody. I just stay for house, the work and the marriage, they don't pursue me for this coronavirus. So how I go do? At their house, now in the town say that they do meeting for Pape Junction, primary school. And I say, what thing that they share for that primary school? In the just they gather people, nothing, no food, nothing. So I beg, Maka go say, now better people, I be, now just, I don't get coronavirus for my body. But in a hungry go bring coronavirus for me, because I don't get anybody. I be Maiduguri, Chibok, Borno State. So I just stay. My boy now, he don't reach 7 years. I ain't the killer. Leave it granny and mama for me. Me, I no go school. I want my children go school. I want my grandmama go school. I don't know how I go do. The work at the mileage, that they pay me 20 years, 20,000. They don't pursue me. At their house. Even now, I never chop. I never do anything. At their house. I beg. Why when I see I see now when I better people come for paper today. Makuna I beg. I take go beg una. God bless una.
We also have with us a representative of the hospital and the administrative pharmacist group of PSN, who is here to talk to us. You're welcome. What's your name?
My name is Ene Daniel Ebune.
There's no cure for COVID-19, but people are taking a lot of speculative drugs as precautions. What do you have to say about this?
Well, as per drugs for precaution, there is no specific drug for precaution, neither for cure nor for precaution. And so we advise that people must be careful. If they are taking preparations, that they know has been effective, maybe for common flu and what have you, this disease is not common flu. And so we still advise caution. If anybody feels unwell, it is better you go to the hospital than to do self-medication. That has been our advice.
But some hospitals are not having enough people. Is that the best advice? Because when people go and they overwhelm the system, what happens?
Well, they cannot do self-diagnosis. We don't advise self-diagnosis. So hospitals still take patients. However, they separate patients. Of course, when you go with your complaint, they'll segregate the patients, the ones that should go for further testing and what have you. So we still advise, seek medical expertise so that you do not self-diagnose, neither do you self-medicate.
My name is Pharmacist Chimamadekwe. I am the Vice Chairman of Pharmacists Society of Nigeria, Abuja, and also the Chairman of this committee, the PSN Abuja COVID-19 Response Committee.
So why was Mpape chosen? And are you people going elsewhere after this?
Yeah, we had planned, in our plan we intend to visit other communities, but Mpape is a pilot scheme. Mpape was actually chosen because it has a lot of population, and most of people are not all that enlightened. So we need to come and enlighten them on what COVID-19 is all about. And there's also this misconception in this community that it doesn't exist. So we need to bring them up to know that it exists and what measures they should take in preventing themselves and preventing the COVID-19 episode.
What are you, for those who contributed to this, are you going to urge other pharmacists? What are you asking them to do?
Oh, we want to use this medium to appreciate all who has donated towards this project and all pharmacists that have brought out their time to make sure that this was a success. We want to thank also the mass media that has taken time to cover this, and we pray that they will be able to disseminate information on what we have done so that people will listen and see that COVID-19 is a reality and that pharmacists have actually done such things in order to enlighten and empower the population towards combating COVID-19.
My name is Ada Igbo 1, Pape Community.
Oh, the Ada Igbo 1. Okay, what does that mean?
Ada Igbo 1 for Pape Community means the daughter of Igbos for the whole Pape community.
Okay.
That's the meaning.
All right.
Yes.
My mask has been trying to fall off, but so how do you feel about this event today?
The event today is very, very good. We appreciate it.
Okay.
If others can be doing this to the villagers or to different communities, we will be very happy, so that they will coach our women what to do, because we women, we are the most important people to learn about COVID-19 because of our children. Our children, they don't know what others are doing, but we women, we are the people to coach them. We are the people to tell our children what to do, because when they go out, if they didn't know what to do, they will come home with coronavirus. So all these diseases that they are calling off, we supposed to learn it, more especially by this time, so that people will know and be aware of this disease. Secondly, again, this coronavirus is real. Let people understand that it is real, because others are affected. Some people that are affected, they are suffering for it now. Some of them are in the hospital. Some are there at home. They are feeling shy to show that they have the virus. So we ask the government to help us by coaching women, coming to different communities to gather women. Like we, the leaders, you ask us to bring women so that they coach them because of their children, because of their husband, because some men used to go out, they don't even care for far distance, they won't care for some of them are snuffing, some of them are taking cigarettes. But when women know very well, know how to handle them, they will talk to them, they will not allow their husband to do snuff, smoke, drink, because all of them are alcoholic. And when they do all this now, they will come home and bring problem for their wives and their children. So because the coronavirus is real, so we have to take care. They have to teach us how we cannot use our hands to touch our eyes, touch our nose, put in our mouth, unless if we use this face mask. So that is why the face mask is very, very important. If they can supply it to every one of us and our children, it will be very good. But we have been asking of it so that they will bring it surplus, so that every one of us will have it. Wherever they are going, they are supposed to use the face mask so that we cannot lack it. If, as they share it today, is very, very important. But we still need many, because we have many people here. We have many people in Pape community.
Okay, let me ask, what will you, as a woman leader, in this community, what will you do after this? PSN is not a government agency. They have done their own part. Is there anything you, as a woman leader, would do with your own team?
Yes, what I can do with my team in this Pape community is to gather them, talk to them, what to do and what they cannot do in order not to contact the disease.
Okay.
So what I can do is when they call us, we tell them when they will come. If the government can tell us, well, we meet them and tell them, see what we need, see what we can do in order to avoid the coronavirus.
Right.
If they can do that, it will be very good for us.
Okay, thank you very much, Ba.
And you too.
And God bless you. As we come to the end of our coverage here, we really appreciate what's happening within the communities. Different groups are rising up to the occasion to create awareness around COVID-19 and reduce the daily infection rates. And we do hope that with different groups rising to the occasion like this and joining their hands to what the government is doing, there will be a quick resolution of this COVID-19 infection. For Akwea TV, Odo Diego Kenyodo in Ipape, Abuja.
Welcome to Akwea TV News. My name is Idajo Aja with the news bulletin. The takeoff campus for the University of Health Science, Akwete Akpa, is almost ready at Otada in the Otokpo local government area of Benue State. Recall that the original campus and the permanent site of the University of Health Science is Akwete Akpa district of Otokpo local government. Before now, little was known about the Otada, a sleepy community in Otokpo, the headquarters of Benue State South Senatorial District. The first and the last time Otada made global headline was in 2017, when a 17-year-old boy, Paul Oloche, caught the world's attention with his inventive wizardry. Oloche became the darling of the news media after pictures of motorcycles, grinding machines, and other machines he single-handedly built surfaced online. Lying serenely by the eastern flank of the nation's ancient city of Otokpo, Otada wore the tagger for the takeoff campus of the University of Health Science, Akwete Akpa. The agrarian community is like a stone throw from the heart of the city. It is known for cassava cultivation and garri processing. Benue State government said it has concluded arrangement to purchase 16 new tractors for sale to the farmers at a record subsidy to enable massive land clearing for agricultural activities in the state. Governor Samuel Otom, who declared this through his chief press secretary, Teve Akase, said the 9 land development sites covering 1,740 hectares have been selected for clearing and preparing for use by farmers in the state. According to him, the land clearing will commence at the end of this current rainy season. Otom declared that the government will not take over the land from the original owners, explaining further that the initiative is in line with his promise to boost agriculture in the state. Recall that in April this year, 50 tractors were sold to the farmers at 60% subsidy. The coming set of 60 tractors is in fulfillment of Governor Stone's promise that funds realized from the sale of the first set will be reinvested in buying more units of the machines. He noted that with more tractors on the way and massive land set for clearing in parts of Benue State, agriculture will receive much expected boost. Meanwhile, the Commissioner for Information, Culture and Tourism, Mrs. Ngunang Adingi, has disclosed that the sum of 828 million naira has been approved by the State Executive Council for the clearing of the 1,740 hectares of land in different sites across the state. Briefing journalists after the ESCO meeting presided over by Governor Samuel Otom, Adingi said ESCO approved the procurement of 30 units of 65 HP and 30 units of 75 HP John Deere tractors to the tune of over 1.6 billion naira for sale to farmers at subsidized rate. Nigerian police on Wednesday, 5th of August 2020 deployed security operatives in Lagos and Abuja as the force arrested members of the Revolution Now group. The deployment and arrest were meant to prevent planned protests by the group. The protest called by Sahara reporter, publisher Omoyole Sowore and Coalition for the Revolution Now and tagged National Day of Action were scheduled to take place simultaneously across major cities in Nigeria in commemoration of the first anniversary of the Revolution Now movement, which held in August 5th, 2019. Convener of the protest had in a statement signed by the Baba Aye and Gbenga Komolafe said to mark the 1 year of Revolution Now movement and relaunch the campaign for an end to enabling looting of public resources and revamping of social economics fabrics of our country. The Coalition for Revolution will stage a massive demonstration for the collective anger and deprivation of Nigerian people, taking off from 2 main points in Lagos and simultaneously across major cities in Nigeria. As the protesters assembled at Ikeja under the bridge chanting solidarity song, armed policemen disrupted the march with tear gas. Some protesters resisted the action and the police had to shoot into the air to disperse them. Some of the protesters were arrested by the police. One of those arrested was Agba Jalingo, publisher of Cross River Watch, who was recently freed after nearly 6 months in detention. They were all detained in Area F police station in Ikeja, Lagos. A mobile court sitting in Oshodi, Lagos State, has however set Abajalingo and other 18 other protesters free. Despite the arrests and appearance at mobile court, members of the group in Abuja maneuvered their way out of police vigilance and staged a protest at Bega Roundabout. The protest planned to hold in states of the Federation and outside the country demanded good governance in the country. Although leader of the group, Omoyele Sowore, was absent, a member who is a lawyer, Pelumi Jemigbasi, addressed journalists on reasons for the protest. Reacting to the arrest of protesters, Lagos-based right group in the Socio-Economic Rights and Accountability Project, SERAP, called on the authorities to release those arrested promptly, investigate attack on protesters, identify security agents suspected to be responsible and bring them to justice. SERAP, in a statement by its Deputy Director Kolawale Oluwadare, stated, rather than suppressing peaceful protests, The authorities ought to protect peaceful protesters and ensure safe and enabling environment for people to exercise their constitutionally and internationally guaranteed right to freedom of expression and peaceful assembly. It urged UN Human Rights Council, Office of the High Commission for Human Rights, African Union, and African Commission on Human and People's Rights to condemn attack on peaceful protests and to put pressure on Nigerians to prosecute perpetrators and respect and protect human rights. Similarly, the Coalition of United Political Parties, CUPP, yesterday condemned the clampdown on protesters. The condemnation is contained in a statement signed by the CUPP's National Secretary, Chief Pet Ame. UN Secretary General Antonio Guterres warned on Tuesday, 4th of August 2020, that the world faced a generational catastrophe because of school closure and the coronavirus pandemic, and said that getting students safely back to the classroom must be a top priority. Guterres said that as of mid-July, schools were closed in 160 countries, affecting more than 1 billion students, while at least 40 million children have missed out on preschool. This came on top of more than 250 million children already being out of school before the pandemic, and only a quarter of secondary school students in developing countries living with basic skills, he said in a video statement. Once local transmission of COVID-19 is under control, getting students back into schools and learning institutions as safely as possible must be a top priority, he said. Consultation with parents, carers, teachers, and young people is fundamental. The UN recommendation for getting global education back on track come as US President Donald Trump pushes for schools to reopen in face of opposition from teachers and parents while COVID-19 is surging in many parts of the country. The coronavirus, which first appeared in China last year, 2019, has infected 4.6 million people in the United States and killed more than 155,000 Americans since February. According to Reuters, death rose by over 25,000 in July, and cases doubled in 19 states during the month. Globally, the coronavirus has infected at least 18.1 million people, and there have been more than 689,000 known deaths worldwide, according to Reuters Rally. Thanks for watching Akoya TV News. My name is Idajo.